In this video, I am going to go over an overview of the Rhode Island Department of Health, including its mission, an overview of health and spending in the United States, and how that information informs the work that the health department does, the three leading health priorities of the Rhode Island Department of Health, and then an organizational structure overview for the health department and the COVID-19 unit. The mission of the Rhode Island Department of Health is to protect and promote the health of Rhode Islanders. And our vision is safe and healthy lives in safe and healthy communities. The Rhode Island Department of Health has an academic institute and is an accredited public health department. What is public health accreditation? It's a voluntary national accreditation program to improve and protect the public's health by advancing the quality and performance of public health departments. The Rhode Island Department of Health has been an accredited health department since 2015. This slide shows a graph of life expectancy compared to spending on health by the United States and many developed countries. On the vertical axis, you see life expectancy in number of years. And on the horizontal axis, you see health expenditure. The takeaways from this graph are that the US spends a lot more than any other developed country on healthcare, yet our life expectancy is worse than those countries. This graph shows how countries are spending its money on medical care or public health and social services. The different colored bars relate to if we're looking at medical care expenditures or if we're looking at public health, social services, and prevention expenditures. What this is showing us is that the United States spends far more on medical care than we do on public health and social services. For every $1 spent on healthcare, most countries actually spend $2 on public health and social services, but the United States only spends about 55 cents. This is important to consider when you think about what impacts health. What are the factors, the determinants, the contributors to health and well-being for a person? This graph shows the results of some research that was done that estimates about 80% of what matters for a person's health happens outside of the doctor's office and outside of their genes or their biology. So the graph shows that 10% of your health or my health is related to our genes and our biology. 10% is impacted by what happens in a physician's office or a provider's office in clinical care. But much of our health and well-being is related to what happens inside our homes, our schools, our jobs, and our communities. The behaviors that we have or social and economic factors that impact us. This is important to think about in the context of the previous slides. So the United States spends a lot more on healthcare, but doesn't have the same type of health outcomes. And we spend a lot more of our budget on medical care compared to social services, prevention, and public health. These findings are very important to the health department, very important to Dr. Nicole Alexander Scott, the director of health, and are how she thinks about how public health should be integrated into all aspects of our communities and the core mission of the health department. So this graph shows, or this slide, I should say, shows our overarching goals and our leading priorities. And so taking those previous three slides all together, The overarching goal of the Rhode Island Department of Health is to positively demonstrate for Rhode Islanders the purpose and importance of public health. Our three leading priorities are to address socioeconomic and environmental determinants of health in Rhode Island, to eliminate disparities of health in Rhode Island and promote health equity, to ensure access to quality health services for Rhode Islanders, including our vulnerable populations. We have two cross-cutting strategies. We have the Rhode Island Academic Institute, which I referenced earlier, which exists to strengthen the integration of scholarly activities with public health. And a second cross-cutting strategy, and I apologize if it's cut off at the bottom of the slide, which is the Rhode Island Department of Health Equity Institute. And the Health Equity Institute exists to look at health services, things impacting health outcomes for individuals at the community level, at the region level, at the neighborhood level, and to think about things by how services are provided, how accessible they are, and trying to really break down inequality across parts of Rhode Island. So the first leading priority is to address the socioeconomic and environmental determinants of health in Rhode Island. And we have a number of internal programs that exist to support that. And we also have a lot of collaborations with community members, partners in the community, external agencies, as well as other state agencies throughout Rhode Island. Our second leading priority is to eliminate the disparities of health in Rhode Island and promote health equity. There are some examples of disparities that exist, both within COVID-19 and previous to COVID-19. So we see disparities in the morbidity and mortality related to overdose by sex or gender. We see geographic differences in childhood obesity, STD burden. We see differences by sexual orientation and gender identity when thinking about the HIV epidemic in this country. We also see racial and ethnic differences and burden of cancer, diabetes, asthma. These same types of disparities are in existence in the COVID-19 pandemic. And our program and the health department look at the burden of COVID-19 by many different groups, communities, neighborhoods, regions of the state, and by all of these different factors to understand who is being impacted more than others so that we can target resources and services in the right way. We use a health equity framework and lens throughout the state and throughout the work that we do. All programs at the health department think about their work with a health equity lens. We support the implementation and expansion of health equity zones, looking at health, wellness, prevention at the community level and not within silos of programs, but across different program areas by regions of the state and groups that are impacted. We incorporate health equity into our programs, and for individuals that are in the COVID-19 unit, they will get a training on health equity in the first few weeks of their time with the program. And again, we partner with state agencies to integrate health equity into all of the work that we do. Our third leading priority is to ensure access to quality health services for Rhode Islanders, including our vulnerable populations. We need to ensure access to care. We need to ensure access to quality health services. And we need to ensure that the services that we provide are of the highest quality and evidence-based. So again, we work with a number of different partners, and we make sure that our services are easy to access. So oftentimes in public health, you hear about hard to reach populations. In a lot of areas, we've flipped that on its head to say maybe it's not hard to reach populations, but hard to reach services. And in COVID-19, we think about making sure that prevention messaging and education is getting to everybody who needs it. Supplies are getting to everybody who needs it. Testing is available to those individuals that need it. And people who need to seek additional care are able to get the care that they need, and they're able to get it in a timely manner. So just an example of how all of these leading priorities can be found needing work and needing to be considered across all of the different programs of the health department. Below the 3 leading priorities, we have 5 strategies, which further clarify and describe the work that we're doing. And then within each of these strategies, there are a number of population health goals that are the goals that are measurable and that we monitor and evaluate to make sure that we are making progress on our strategies and our leading priorities. So our 5 strategies are to promote healthy living for all through all stages of life, to ensure access to safe food, water, and healthy environments in all communities, to promote a comprehensive health system that a person can navigate, access, and afford, to prevent, investigate, control, and eliminate health hazards and emergent threats. And certainly in the work of the COVID-19 unit and the EpiOps unit, there's a great emphasis on investigating cases of disease, identifying people so that they can be placed on isolation, ensuring that the people around them are placed on quarantine so that we can disrupt transmission as much as possible. And then to analyze and communicate data to improve the public's health. And we have a massive data analytics and modeling team, which is looking at data related to COVID-19 and communicating it with stakeholders in state government, at the health department, and different programs, as well as communicating to the public and to our media entities to make sure that there is a strong understanding across the state and all communities about what's happening with COVID-19. So again, these 5 strategies, as well as the 3 leading priorities, are exemplified in the work that we do with the COVID-19 unit. And as you join specialty teams and move on in your work, you'll see more and more how we use these strategies and leading priorities to inform the work that we do.